السلام عليكم. بسم الله الرحمن الرحيم. أعزائي الطلبة, this lecture about noise-induced hearing loss and presbycusis. Acoustic trauma or noise-induced hearing loss. We start with A. Transient acoustic trauma or temporary threshold shift. Most people have experienced transient acoustic trauma, for example, after listening to a loud music. The mild hearing loss and tinnitus quickly resolve, but repeated transient acoustic trauma can cause permanent symptoms. B. Acute acoustic trauma. Permanent damage to hearing can be caused by a single brief exposure to very intense sound, which is called impulse noise. May also arise from a sudden, very loud noise, such as an explosion, gunfire, or powerful crackle. Powerful crackle معناتها المفرقعات القوية. It is caused by sound greater than 140 decibel. So no impulse noise more than 140 decibel is permitted. Explosion can cause rupture of the tympanic membrane, ossicular chain disruption, damage to the outer hair cells, disrupt the organ of Corti, and rupture of Reisner's membrane. This is the typical pure tone of patient with acute acoustic trauma. This pure tone reveals a dip at 8 kHz. This is typical of acute acoustic trauma. C. Chronic noise-induced hearing loss result from long-term exposure to loud noise. This is seen more often in people who have worked in heavy industries. It can occur in any circumstance where there is repeated exposure to loud noise, such as those from heavy equipment, chainsaw معناتها الكوسرة أو المنشار الكهربائي, and firearms الأسلحة النارية are common sources of noise-related hearing loss. Portable music devices such as MP3 players or iPods also can cause noise-related hearing loss if played loudly for a long period. So we should avoid using loudspeaker for a long time. There is a relationship between the volume of sound and its duration which cause damage. Louder sounds will cause damage at a shorter exposure time. 8 hours per day of exposure to a sound level of equal or more than 85 decibels usually cause damage. So a noise of less than 85 decibel sound pressure level 8 hours a day for 5 days per week is the maximum safe limit. Tinnitus is the prominent feature in this condition. Usually patients with chronic noise-inducing hearing loss present with tinnitus and later on with sensory neural hearing loss. The audiogram has a classical appearance with a dip at 4 kHz. This is the typical audiogram of a patient with noise-induced hearing loss. There is bilateral symmetrical dip at 4 kHz. This is the typical pure tone of chronic noise-inducing hearing loss. Noise-induced hearing loss is preventable consider the following to prevent further noise damage: health and safety at work, provision of ear protectors like earplugs or ear muffs. الواقيات السمعية هذه اللي تحمي الأذن من الأصوات العالية should be used where noise level exceed 85 decibels. They provide protection up to 35 decibels. الاير بروتكترز هذه الواقيات السمعية تخفض الصوت بمقدار 35 decibels. Routine hearing screening for occupation at risk. They should have a pre-employment and then annual pure tone for early detection. عادة العامل قبل ما يبدأ بالعمل يسوي له بيور تون، وبعدين سنويا يعيدون له البيور تون for early detection of noise-induced hearing loss. Because noise-induced hearing loss is an occupational hazard, and then the compensation should be asked for. يحتاج إلى تعويضات مادية في حال وجود noise-induced hearing loss. For established damage, consider treatment by hearing aids. It is irreversible and there is no cure. So we provide the patient with hearing aids to improve hearing and to improve the tinnitus. Presbycusis. This term derived from a Greek word. Presbys, elder, acousis, hearing. It is age-related hearing loss. Presbycusis is a degenerative disorder. Is the term describe the hearing loss of old age. It is due to gradual loss of outer hair cells of the cochlea. This leads to not only hearing loss, but also confusion in sound. Typically, elderly patients complain that they struggle to hear clearly in background noise. Such a hearing loss can be socially isolated. عادة مريض البرسبايكوسيس يقول أنا أسمع الصوت بس ما أقدر أفرزن الحكي، وهذا يخليه ينعزل عن المجتمع مالته. The condition is characterized by a gradual hearing loss in both ears with or without tinnitus. Usually, the patient complains from sensory neural hearing loss with poor speech discrimination and tinnitus. On a pure tone hearing test, the hearing loss will affect the higher frequencies, leading to a typical audiogram. Usually, presbycusis caused by damage to the outer hair cells of the organ of Corti. Here the damage at the area of outer hair cells. This is the typical pure tone audiogram, reveals bilateral symmetrical high frequency loss. Usually the loss in the higher frequencies and the low frequencies are not affected. This is another pure tone of presbycusis, bilateral, symmetrical, high frequency sensory neural hearing loss. Poor hearing can make communication difficult. Tinnitus can be distressing to some patients. Also, presbycusis, there is no cure. It is irreversible damage. What we provide the patient with hearing aid. And the hearing aids can be of great help by amplifying sound and mask the tinnitus. When hearing aids are used, it is important to amplify high frequencies because the loss in the presbycusis is found in the high frequencies. And audiograms are important for the prescribing of hearing aids. Good luck.